Hi everyone, welcome to National Counseling Examination Review. This is 5-minute videos, and today we are going to be in Domain 2, Intake Assessment and Diagnosis, and we are in Subcategory G, to consider co-occurring diagnosis. Now let me first define what are co-occurring diagnosis, or you may also see the word comorbidity. So co-occurring or comorbidity refers to individuals that have two or more mental health disorders, and that suggests that there is a interaction one with another. For example, one diagnosis may interact with another diagnosis. You may see that, for example, with alcohol use disorder, or AUD. Many times, alcohol use disorder and depression have a positive correlation. Many clients would take alcohol because it's readily accessible and easy to access as a form of treating depression symptoms. So, for many, that would be a common co occurring disorder. Other examples of co occurring disorders could be substance use disorder and schizophrenia. Again, the client with schizophrenia symptoms could use the substance use disorder as a form of treating the different symptoms that they are experiencing as a form of self medicating. Another common co occurring disorder are the anxiety disorders, for example, generalized anxiety disorder, or maybe some of the phobias, along with drug addiction. And again, the use of self medication could be prevalent, as well as trying to treat or trying to cope with the symptoms through the use of drug use or abuse. Another co-occurring disorder that it could be considered would be the learning disability and mental illness. Sometimes there is depression due to the frustrations in learning, or there could be issues with control or perfectionism. Body dysmorphia comes to mind. So, those types of things are issues that should be considered. And many times, again, clients may have issues that relate to one another, right? So, as a clinician, you should always keep that in mind. You should always consider things like substance abuse, mental illness, as well as genetics and social factors, and how all of that plays role. Other things to consider are things like chronic stress, the amount of stress the client is experiencing, history of trauma, the childhood adverse or childhood trauma, the access to drugs, or how easy they are able to get any substance, um, peer drug use, the individuals that they hang out with, their use of drugs, family factors. There's genetic components to diagnosis, such as depression, and then also cultural media factors, as well as social acceptance. So, all of those are factors that could have a correlation with the different co-occurring or comorbidity disorders.